I'm Anat Carmon.
I'm Emily Goulet
with the Fertility Institute of Hawaii. I'll let Dr. Fraterelli introduce himself as well.
John Fraterelli with the Fertility Institute of Hawaii.
All right, excellent. And then today we're going to be talking about the COVID vaccine and any questions that you guys have and fertility. So I know, John, Dr. Fraterelli, maybe you want to get started.
Well, I guess we do have some questions from staff and some patients that we get all the time. One is, should people take the vaccine if they're trying to get pregnant? And we have this all the time, obviously, because our patients are here trying to get pregnant, and some of them are immediately trying to get pregnant because we're ready to do an embryo transfer on them, and then they're asking us this question, and we're putting in an embryo in next week. And so the answer, at least from the American College of Obstetrics and Gynecologists and the American Association for Reproductive Medicine, is yes, you should not dissuade anyone from taking the vaccine. But then the truth also is we don't have any safety data on it. But because of the way the vaccine is made, it's not a live vaccine, so it should be perfectly safe. And we know this because of all the other vaccines and that have been used. But this one hasn't really specifically been tested for pregnancy, but we assume it is going to be safe just because of the knowledge that we have. And even though it hasn't been tested in pregnancy, it has been given to a lot of pregnant patients who didn't know they were pregnant at the time. And there hasn't been any adverse consequences to those pregnancies.
Right. There are a few important things to note. So first of all, not only is this exciting because it's a vaccine in a global pandemic, but it also is a novel type of vaccine. So it's an mRNA vaccine. And so on the one hand, that's exciting because it's a new type of vaccine. On the other hand, people are anxious because it's a new type of vaccine that we haven't really utilized before. However, mRNA does not replicate. It does not change your DNA. It's not expected to have any long-term consequences genetic-wise, right? And so the importance of that, I think, is sometimes lost on people when they're concerned about, mRNA. Is that going to affect me in the long run? The way that mRNA vaccines work is usually a regular vaccine, the mRNA vaccine, utilizes a protein which elicits an immune response. mRNA, when that is injected, it causes your own body to create the protein which elicits the human response. It's easier to mass produce, which is and easier to kind of make and market, which is why I think it got to market very quickly. And I think that in terms of safety, it should be very similar to the current, non-live vaccines that we utilize.
In addition, with the mRNA vaccines, for individuals who are concerned about the vaccine being in their body, mRNA is extremely short-lived. It only survives in the body for a couple of days. That's one of the reasons why when it is produced and transported, it has to be transported under very special, very cold conditions to make sure that the vaccine maintains its integrity and doesn't degrade. So after the injection, what was injected is pretty much metabolized within several days. So there are no lingering parts of the vaccine within your body. This vaccine, the infectious disease world is very excited about, because unlike the other vaccines that have been produced in the past, which needed to be cultured in things like eggs, which sometimes caused allergic responses, or needed adjuvants like aluminum in order to elicit an immune response, this sort of vaccine is considered extremely clean. There are very little additives other than the mRNA to make this vaccine effective.
And so what about side effects? What are some of the common side effects with this vaccine, Dr. Fraterelli?
I had to unmute myself there. I was actually going to follow up on what Dr. Goulet just said as well. You know, um, it, it's important to realize that these messenger mRNA, the messenger mRNA vaccine, not only being novel, but we were able to get this done in less than a year. You know, it took, you know, like, you know, the vaccines for like measles, it took a decade for them to get the vaccine. And so it's a really, even though no one's happy about how long it took, and it took, you know, it really is amazing that because of the technology now, not needing to use the virus itself to get a vaccine and use a live vaccine, that we're able to get it done so quickly. And as you said, you know, one of the nice things about the vaccine too is that, you know, what it does is it targets that spike protein, right, that everyone sees on TV, and that's really important because as the virus replicates or mutates, that spike protein probably isn't going to change, and so because the vaccines are still attacking that spike protein, then the vaccines should still be potent against mutations, and so that's very nice, and then very hopeful. As far as side effects, I think one of the things I can say is that the three of us, all had the vaccine, and we've all had different side effects. I think that, you know, certainly everyone who gets a shot in the arm is going to feel like they got a shot in the arm, and that shot in the arm, the initial shot in the arm, I think, was much more than what a normal flu shot would be. Again, my arm was kind of sore for about 48 hours. Felt like somebody, Dwayne Johnson punched me in the arm or something. The second vaccine I got was less. It felt like, you know, Dr. Carmone punched me in the arm. It was not, you know, it hurt for, you know, 12 hours or so. But that is, you know, pretty mild. I think that's pretty common I think everyone has that, though. Everyone has that side effect. Some people have more side effects, and some people have more severe, you know, symptoms and side effects. I think the most common thing that people have is kind of a mild flu type reaction, typically to the second dose as opposed to the first dose, and that can last for 12 hours up to 48 hours for people, and we definitely are seeing that. You know, our staff, we've had about 2/3 of our staff get the vaccine, and yeah, there have been a lot of them with that second shot, that their second vaccine, that have had that flu reaction type and have been gone for out for the day, and sometimes a little bit more. In general, though, safety wise, it'd be very safe. There's really, it's, as Dr. Goulet and Dr. Carmon said, you know, because it's mRNA, it's really short lived. It's out of your system. So there's really no harm to reproduction. Like, it doesn't harm, it doesn't change your sperm, doesn't change eggs, it doesn't affect fertility whatsoever. So I think that's obviously important to know.
I also just want to comment about the side effects. So even though, you know, both of us.
Oh yeah, side effects. Sorry.
Yeah. Well, you know, both of us had some side effects and sort of flu-like symptoms. It's important to note that it's not the flu. It's not COVID. It's not a live virus. It's not an inactivated virus. You're not getting COVID. You cannot. It's not possible to get COVID from the vaccine unless the person giving you the vaccine has COVID and coughs on you or something. You're not going to get COVID from the vaccine. The response that you'll feel, the immune response that you feel, is just that. It's an immune response to the protein. So it's to the protein that was created by the mRNA. So it is just a feeling that you get, and it is not. It's not a virus. It's not something that you can spread to others in any way. So I think that's a really important point as well.
I know some individuals have asked me who should not get the vaccine, who should be excluded from getting this vaccine. Certainly after you are pregnant, it becomes an individual decision after discussion between you and your OB. But aside from that, there are very few exclusionary criteria for not getting the vaccine. If you have had a severe allergic response in the past, such as Guillain-Barré syndrome or anaphylaxis syndrome to another sort of shot, it's worth talking to your doctor as far as what the chances are that you could have another severe reaction to this shot. But in general, most people who have had severe reactions to shots in the past know what specific ingredient was in that shot that caused that reaction. For example, they're allergic to eggs, and that shot was cultured in eggs. So having a severe allergic reaction is not considered a contraindication, but it is a discussion with your doctor as far as if you should proceed or not. I've also had other individuals tell me that, if they get sick, they would rather get sick from COVID than get sick from the vaccine. And I don't know, I got fairly sick from the vaccine, and the entire time I kept thinking, if the vaccine is doing this to me, I can't imagine how sick I would have actually gotten with COVID itself. And, as miserable as I was at home for 2 days with a fever, I would have been much more miserable in the ICU with a tube down my throat. So I'm grateful that this vaccine exists and has been able to give me and my family a little bit of protection.
Right. And I think Dr. Fratarelli already mentioned this, but to really bring that point home, we don't have any data regarding the impact of the vaccine on fertility because it's a brand new vaccine, but there really is no reason to think that this vaccine would impact fertility. mRNA is degraded quickly, and there's no reason to think that this would in any way impact fertility.
One really nice thing, though, about getting the vaccine prior to pregnancy is that you have those antibodies in your system, and you can pass on those antibodies in your placenta to your baby. So you can offer your baby some protection in utero and before the baby is born. And those antibodies even last in the baby after the baby is born for about 6 months.
So I mentioned earlier that the question I get from my patients all the time, I'm sure you guys get that same question. Are you getting any other questions from your patients about the vaccine or concerns about the vaccine at all?
Yeah, I mean, I think every single patient so far, I think almost everyone has asked me my opinion about whether or not to get the vaccine, either prior to treatment or during a pregnancy. And I think that I tell them that prior to treatment, it makes sense to get the vaccine, or prior to pregnancy, rather, it makes sense to get the vaccine. In pregnancy is really, really tough answer. It should be safe, but we just don't have data. And as physicians, we rely very heavily on data, on actual real life cases. And although pregnant women are right now receiving the vaccine, and there are no adverse reports now. Again, it's just sort of a brand new vaccine, so we don't have that information. The American College of Obstetrics and Gynecology kind of says something similar. They take a stance of leaving it up to the patient and the physician. They say that pregnancy is not a reason to kind of prevent somebody from getting the vaccine who may be at high risk for COVID. So certainly it seems like pregnant healthcare workers who are at high risk probably should consider it. Women who are pregnant who are not at high risk, maybe they can skip it. So it really, there's not an easy answer to it. Which I think is why we're kind of having this Facebook Live discussion about it, rather than just putting out a statement and emailing it to everyone, because it's kind of a tough thing to answer. I think each patient needs to assess their own risk along with us or with their physicians.
Right, especially if you're at high risk. We do know that catching COVID in pregnancy does lead to increased risks of obstetrical complications. Placentas that have been looked at under the microscope after the babies have been born, and a mom who had COVID during pregnancy, those placentas don't look the same as women who did not have COVID. Another one of the questions I get from my patients is, well, I've already had COVID, so I don't need the COVID shot. And that's not necessarily true, because what we've seen with COVID is that some individuals can recatch COVID again, become symptomatic again, and spread the virus again. So by getting the vaccine, even if you have already had COVID, should give you a much higher rate of protection against becoming symptomatic with the virus. The rates of efficacy of this vaccine are fantastic. It's one of the most effective vaccines that has ever been produced. The rates are about 95%, which is certainly much higher than the effectiveness of the flu vaccines that are currently being produced.
Yeah, and I think, unless Dr. Frederelli, did you have other things to say about COVID and the COVID?
I think I'm muted. No. Okay. So I think one of the other questions I get from patients sometimes is, which vaccine should I take? Should I take the Pfizer or the Moderna vaccine? And the reality is, when you look at, as Dr. Glade just said, it's about 95% of people are effective for both. I think 94 point something percent for Moderna and 95 for Pfizer, but basically the same. And then the only really difference that I'm aware of is that with Pfizer, you have to get the shot. The second injection 3 weeks later, and with Moderna, it's recommended to be 4 weeks later. And that's really the only difference that I really know of. So, I typically recommend that, whichever one you can get, you get. There's not one that's better than the other.
Right. I agree with that.
And it's important to mention, too, that there is a 5% failure rate, and that's due to different things. Sometimes people are exposed before the vaccine can build its optimal immunity. Other times, for other reasons we don't understand, individuals did not produce the correct response and to protect themselves with the antibodies. So with a 5% failure rate, there's about 1 in 20 individuals when exposed to COVID who could still get sick. So it's important to continue doing all the things that we have been doing to prevent COVID transmission, wearing a mask, sanitizing your hands, and practicing good hand hygiene, limiting large gatherings, all the things that we have been doing prior to the vaccine in order to protect those around us.
And that sort of reminds me that these trials, right, they test for symptomatic COVID. So what we know is that that the vaccines are 95% effective in preventing symptomatic COVID. What we don't know is whether or not somebody who's been vaccinated is able to transmit COVID, or kind of have COVID, be asymptomatic, and transmit it. It's sort of logical that that if you're eliciting an immune response against the COVID, that against the virus, that you are probably less likely to transmit it. But that wasn't tested in the trial. We don't have the data, and so sometimes some patients, if you're signing paperwork for it, you might actually see that on there, okay, where that it doesn't necessarily prevent asymptomatic transmission. The truth is we don't know. We don't have the data for that. Hopefully it does. We don't know. But that brings up the point where you still may need to protect those around you who are not vaccinated, right? Because, and you still may need to, do all the things that just
Yeah, no, I think that's very important for people to realize that you still have to do everything that you're supposed to be doing, wearing masks, sanitizing, social distancing. But it also kind of gives you a little bit of relief too, because you do feel like there's that extra protection on top of everything else that you're doing.
Yeah, there's no question. And I mean, the idea is that if most people are vaccinated, that we're going to be able to, get things back to normal, and we won't have to do this. I hope so. I mean, I still wash my hands and all, but I'm hopeful that, I won't have to do the type of social distancing that we're all having to do. I did want to bring up kind of other vaccines in pregnancy as well. I don't know if you guys are done talking about COVID. Are we done with that?
We might circle back.
All right, we might go back, but just bringing up other vaccines in pregnancy, which vaccines are recommended, which are not. So I think that overall, people should keep in mind that the vaccines that are recommended in pregnancy are those which are non-live viruses. So things like the flu shot is recommended because it is not a live virus. You cannot get the flu from the flu shot, and pregnant women can get very sick from the flu. Actually, unlike COVID, where it was sort of questionable how much at higher risk pregnant women were with the flu, pregnant women are definitely at higher risk. And so receiving the flu shot in pregnancy is extremely important and safe. Other vaccines, so the vaccines that you want to avoid are those which are inactivated viruses, like, for example, the MMR, varicella. Those are the ones that you do want to avoid in pregnancy because although rare, there have actually been reports of birth defects from this inactivated virus potentially impacting the fetus.
So if you're planning on getting pregnant and you visit your OB-GYN for your annual well-woman exam, or you're having a preconception visit, those are two antibodies that you might want to ask your OB-GYN to test you for titers to see if you have antibodies and immunity against rubella and against varicella, because prior to pregnancy is when you would want to get those vaccines or the boosters for that vaccines, because in some instances, some girls have had chicken pox and their immune response has waned, or they've had the vaccines against rubella and their immune response has waned. And so getting a booster to those vaccines can be beneficial to protect you and your baby during pregnancy.
And so the other one that I don't think you mentioned this one, but the other one that you shouldn't take during pregnancy is the HPV vaccine, which I know is fairly popular now, being taken, especially, so people that are in their 20s that are maybe taking the vaccine. If you shouldn't be taking that if you shouldn't take that if you're pregnant.
Correct. There's one more vaccine that your OB might or should be mentioning and recommending that you get in pregnancy. In addition to the flu vaccine, the Tdap vaccine is also routinely recommended. It's commonly known as the tetanus shot. That's certainly one of the conditions that the Tdap vaccine prevents against. Typically, we think of the Tdap vaccine as lasting for about 10 years, and that's true for the tetanus component of the vaccine. But the pertussis part is what we worry about in moms and in neonates and newborn babies. Pertussis is a severe respiratory illness that can cause swelling of the trachea, and in newborn babies, when their airway is only about as big as the straw, their airways can swell shut. The pertussis component of the Tdap vaccine, that immunity only lasts for about a year, unlike the tetanus part, which is about 5 to 10 years. And so for that reason, we do recommend during every pregnancy, every pregnant woman and close caregivers, so spouses, grandparents, if they live in the home, should be getting that vaccine as well to protect the baby from contracting pertussis.
We do have a question here. So it looks like the question here is regarding the UK policy of recommending waiting for 2 months after the second dose of the vaccine before trying to get pregnant. And that is different than the ACOG statement, which is sort of a little bit more ambiguous, just saying pregnant women can receiving the vaccine if they want. I think that, again, since there are no hard data about this, experts are kind of getting together and coming up with recommendations that they think make the most sense. I don't think that these recommendations are based on any observational data that we have at this point. I don't know if you guys have any other thoughts about that.
I find that very not necessarily amusing, but different than what you would normally see from the UK and the United States. Usually there are medications and drugs that are approved internationally, and then the FDA will not approve them, even though they're perfectly safe and used elsewhere. And here we have something similar but different, but where the UK is saying you shouldn't, you should wait longer before you take a vaccine, and the United States is saying, take it sooner. But as Dr. Carmon said, I think it really is just a matter of opinion, because there are no data out there, and it's really more theoretical than anything. That there's theoretically there should not be any adverse effect on pregnancy, and they haven't seen it in the people who were pregnant during the trials, and so because of that, they're saying pregnancy, it's the risk versus the benefit, right? So the risk of getting COVID is much greater, and so you want to make sure that you get that benefit of getting the vaccine if possible.
I see there's also a follow-up question to that. I think it's asking about our side effects here. So I know that Dr. Fraterelli only had a sore arm because he was going around the office bragging. So I can answer that for him, that he's like so strong and stuff, because he really didn't have any side effects. Both of us did experience side effects. I mean, again, nothing dangerous. I really certainly don't want to be discouraging people from receiving their vaccine, but both of us were, had some fever and chills and didn't feel very well for 24 hours, even up to 48 hours. Headache was another thing that I enjoyed. So it wasn't great. And I also did have the sore arm, but it was everything else that was rather upsetting. And it happened after the second vaccine. But again, it's just an immune response, not a dangerous immune response. And it went away, and I'm fine now. For the most part. No, I'm fine. I'm okay. I think that everyone's going to obviously react differently, just like congrats to Dr. Fraterelli. Another comment here. I do want to say though that I did read some literature, and I can't remember if I read it on like a blog or not, but I did read that older people are less likely to have severe reactions. So that's why.
I think you just made that up so that I'm trying to explain why I had less reaction.
Yeah, so we're like sort of young and healthy and everything, and that's why we had a really strong
tough time.
Yeah.
Yeah.
But does anybody else have any other questions? Any other last closing thoughts here?
Well, for our fertility patients, I know I've had individuals ask for their spouses who may have abnormal sperm counts, how will the vaccine affect their semen analysis? And it's hard to say, but in general, we say that if has had anything adverse in his health for the past 3 months, that could certainly affect his sperm counts. About 15% of individuals will experience a fever after getting the vaccine. And so if an individual has a fever after the vaccine, we would expect a dip in the sperm counts or the sperm quality, but that dip should be relatively minor to moderate. It's not going to demand from beautiful sperm to no sperm. It's just going to be a dip that will recover in a few weeks to a few months.
And I think it's important to point out too, though, that because when you're looking at sperm and semen analysis, you're looking at millions typically, and so with the quantity that's there, it's rare that any dip has any clinical effect, meaning it decreases your pregnancy rate at all, whether you're getting pregnant naturally with intercourse or with IUIs or with IVF. That would be very rare.
All right. Well,
I think maybe I want to say just one more thing. So when I do see patients and they ask me about the vaccine, I do recommend that they take it. But obviously it's a personal decision for them. If someone is really concerned with pregnancy, and then obviously again, if they're pregnant, then they should talk to their OBGYN as well. and then decide if personally if they want to do that. If someone's getting ready to get pregnant, we have an embryo that we're going to be transferring in the near future. What I do offer them, if they're concerned, to if they have the option to get the vaccine right away, to get the vaccine and wait a month after taking their second vaccine. And so it may delay their treatment, it may delay them getting pregnant by 6 weeks, but then that gives them the peace of mind that they waited an extra month after the vaccine, because that's typically what's recommended with the other vaccines. If you get them before pregnancy, that you wait a month before trying to get pregnant. And so I think that worst case scenario, that's what I would say with this vaccine as well. And then patients then have at least the peace of mind that whatever happens with that pregnancy, because not every pregnancy ends well. Every pregnancy test is positive. Not everyone. There are miscarriages that happen, and everyone always wants to find the cause and the reason, and sometimes there isn't one. But sometimes you can at least take that out of play and know that wasn't it. If someone is really concerned about that.
Yeah. All right. Well, thank you, everyone. Please feel free to add comments to this if you're watching it later. We can certainly try to answer those for you, and hope that you guys learned something.
Dr. Carmo, Dr. Goulet, it's been educational as always. Thank you.
Thank you.
Thank you.
All right. See you guys soon.
Bye.